Hello viewers and welcome to our today's edition of the program, the Health Center with Ozion at Kunie. And here I bring you the topic dysmenorrhea. What is dysmenorrhea? Dysmenorrhea is simply the medical term for painful menstruation. Painful menstruation? Oh yes, painful period as you might equally call it. So what actually causes this is what you might want to know at this time. It happens to women. This is caused by, or categorized as two. The one that is caused by your normal body chemical that helps in the uterus. Uterus is also known as the womb. The uterus, that part is a very contractible muscle that helps the growth of the child or the embryo. So in that, we have a chemical known as the prostaglandin. Prostaglandin is produced in this lining of the muscles of the uterus, and it helps in the contraction of the uterus. When this contracts, it causes pain. And when this is produced, the increased production of this causes pain. And it is increased in its production at the early days prior to the bleeding time. So before the bleeding starts, the woman is already having this pain, like 2 days to her period. So that time, the person that is having dysmenorrhea begins to feel the pain. The prostaglandin is high. And when bleeding begins and the rushes begin to rush out, it is shedding out with the prostaglandin and the pain is reducing. On the other hand, some women suffer this problem of dysmenorrhea, not because of the production of prostaglandin, but because of an underlying problem. They are having some kind of sickness, diseases that they have not treated. And certain diseases we have treated in this particular platform. Certain diseases are diseases we call reproductive diseases. Certain diseases come by because the woman, most of the times, these women are women who started their menstruation quite early. Of course, you know it's not a factor you can change yourself. It happened, but you can do something to be able to avoid it going too much to cause you some of the diseases that they can cause you. There are already researches of what you can do to ameliorate the exacerbation of this or even prevent it from furthering, and that is what we explained in the different videos where we treated those diseases individually. Here we're just trying to let you know that those conditions can cause you dysmenorrhea, painful menstruation or painful period. And when it is happening, you can as well check yourself to know whether you have these diseases or it is the normal, ordinary prostaglandin production that causes you this pain. The other way, if this periodic pain is increased other than the one I just explained in 2 days prior, that is, goes beyond these 2 days, beyond these 5 days, like 2 days before the period and 5 days within the period, and it extends beyond this time, it is longer than the one that is usually happening, as I just explained, then begin to suspect it could be this underlying problem. I'm not saying it's exact at this moment because people's individual body differences matter, but just to know that these physical examinations can help to determine whether you are having this before the doctor goes ahead to scan and find out the exact disease condition that is making you to suffer this pain that is not just ordinary. However, how do we manage these pains and how do we know these diseases? Management of this pain varies depending on the condition you are suffering from and as well how this pain is. But on the normal level, whichever one it is, you're finding yourself in this pain, you begin to take the non-steroidal anti-inflammatory drugs, the NSAIDs, which are like ibuprofen, like the naproxen, and any of these NSAIDs. They can manage it. But if you are someone who cannot take this NSAID, because to some people it increases their blood, of course, naturally NSAID increases bleeding, but in some people it does it faster. Some people may not even be able to take it because of allergy it causes them. Then you can go for acetaminophen or called Tylenol, but you need something that will reduce that pain. That's why medication is being suggested now. But if you cannot, wow, that's great. But what matters is that ensure that your psyche remains balanced, that this does not disrupt it and you're having anxiety. Then, on the other hand, There are other things that you can do to manage this pain, like hot pad. Yes, that can help you. Some people use hot, but you cold. But what matters is that you have something, because this pain comes at the pelvic, lower abdominal area, even up to the lower upper part of the thigh. So this kind of discomfort, we may have to use pad that is hot or a cold one just to assuage this pain and become better. What else? Resting and minding the kind of food you eat. How do you mind? You have to take foods that will help your body to really adjust this, produce certain anti-inflammatory substances like vegetables, fruits, and whole nuts. What else? I've mentioned resting. The other thing that is important is ensure that you desist from caffeine producing foods. Yes, caffeine. Some people might be taking cola, reduce or desist from that because it produces caffeine. Coffee itself, yes. Those who take alcohol, how do you feel about it? But then smoking is a major factor. Smoking is a major factor in terms of causing you this pain and then increasing this pain when it's already happened to you. Remember, smoking narrows the muscles, causes the constriction, and that increases whoever, even if it is the normal prostaglandin problem or the one that is caused by the disease, thereby exposing you to more harm that this disease can cause you. Another thing is, if you want to be taking pill, another pill that can help is hormonal pills. That's those who are taking pills for anti-pregnancy pill. But then, are you the person that can take this pill? Those are the conditions, those are the factors that you will check before beginning to take this pill. How do I mean? Some people may not be able to because you might want to get pregnant, because this problem doesn't stop you from getting pregnant. So how do you now begin to take the hormonal medication when you still want to be pregnant? But if you're not one that is about to get pregnant, then that might be considered. What else? Exercise can help you to manage this. Exercise regularly. Massaging can equally help you. Taking green tea and supplements like vitamin D is important for you to manage this, because that will help your hormone in the way it will be working. What are these diseases we are talking about? I know you're wondering that. Okay, these diseases include diseases like endometriosis. Yes, endometriosis is the growth of tissues on the endometrium, the lining of the uterus. Yes, growth of tissues that goes even beyond that side, on and around it and beyond that side. There is that topic already discussed. Go to the video on our dashboard, or if you're watching from YouTube, you see the video already discussed. So that gives you a details of what endometriosis is, so you don't just hear everything from this particular one that addresses the pain that a woman suffers, including you, a woman watching me at this time. What else? Fibroid. Of course, we have treated fibroid. Is another thing that causes you pain in that area and around that time that you are having menstruation. What else could cause you this? Pelvic inflammatory disease. This one is infection that comes from sexual practices. During sexual intercourse, you have this kind of problem when you get contract gonorrhea or chlamydia, and that could proceed, if not treated well, into causing you pelvic inflammatory disease. That topic as well have been treated. Go to our dashboard, go to our YouTube and watch them and get the details of how this happens and the treatment for that pelvic inflammatory disease. What else? Cervical stenosis, the constriction or the narrowing of the cervix, which could be caused by surgery or other factors. What else? Congenital problem that makes your menstruation to be painful. There are some congenital problems that causes the narrowing and the other conditions. That one, we will treat it as a separate particular topic. Not yet for now, but watch out for that particular topic. So these factors can make a woman to suffer painful menstruation, and if not examined very well, you might give your problem to something else and be explaining it in a different way. How do you get this examined? Blood and physical examination, as well as using scanning, ultrasound, and as well as whatever scanning machine that could be used. Doctor will really choose which one, because this, you don't have to use every scanning, because one could just get this and it's all gotten well what actually is the cause of this problem. So for now, just trying to get you know that there are certain types of pain that could be that there's a certain categories of pain that makes it to be differentiated as it is. Not just whenever you feel the pain, you conclude that it is just a normal pain that happens to a woman. No, you need to check yourself and the way this pain manifests, the duration, the way the symptoms you see, and what are those symptoms? The symptoms of the pain, the pressure it causes. Sometimes it goes to vomiting, it goes to nausea, it goes to headache. All these can manifest depending on the one that you're suffering from. And then when the proper examination is carried out, the doctor will find out and have a conclusion. And the treatment begins from there. Only when you check yourself. Obesity as well can equally make you closer to these kind of problems. But for now, get the details you see on our screen, and I wish you the best. Thank you, and continue to be with us at Kunie. This is your host and regular anchor, Dysmenorrhea specialist.